Sign and symptoms of irritable bowel syndrome. It is called as syndrome because it is combination of the various symptoms and signs. Though there is no organic pathology in the intestinal tract, gastrointestinal tract in this disease, because it is absolutely disorder or the abnormality of the bowel movements or the waves which are produced to propel or push the excreta or the waste products produced by the small intestine onwards to the anal pathway. So, the main factor, in addition to others etiological factors, it is the stress, anxiety, and depression. Any psychiatric factors, they are also responsible as the trigger factor, or you can say the risk factors. So, it is a main point, at least in this irritable syndrome. So, which modify or make the reflex or the impulses which passes from the visceral hypersensitivity, the reflex passes onwards into the central nervous system for interpretation, and then the orders they are obeyed by the muscles of the gut wall to produce the waves for defecations. The symptoms are lower abdominal pain, bloating, flatulence, nausea, vomiting. Then there is constipation, diarrhea in alternate fashion. The stool consistency and the frequency is changed in this disorder. Fatigue, lethargy, weakness, because this disorder make a big upset in the normal life of the patient. Patient cannot lead a normal and decent life because he suffer from alternate constipation, diarrhea, and mixed conditions. So he cannot perform his normal duty, normal function, normal, the demands of the and activity of the life due to this troublesome disorder. Now, there is no diagnostic procedure to detect this disorder, only the history of the patient. The symptoms. Symptom means there is abdominal pain. The diagnostic features, they are governed by the Rome criteria. There is abdominal pain, mostly lower abdominal pain, which is relieved by defecation or evacuation. The pain appears at least once weekly up to the next 3 months period. There is change in the consistency of the stool. There is change in the frequency of the stool. So these are the main points. Moreover, the diarrhea appears in the morning hours. Mostly. Rarely it appears in the night. So this is also a diagnostic feature. कि diarrhea appears in the day hours. The flatulence feature is produced by the gastrointestinal infection. Bacteria produces fermentation in the fructose and the lactose present in the various foodstuff that produces gas and which produces belching, bloating, abdominal distension, and flatulence. Moreover, the various diagnostic procedures are performed only to exclude the other pathologies, other diseases. So, only there is the history of the patient and the symptoms of the patient. They are they are diagnostic for this disorder under the umbrella of the Rome criteria. Abdominal ultrasound is performed to visualize the pathology in the gallbladder, in the biliary tract, and the liver. Urine test is performed, stool test is performed, and culture is performed for detection of the various pathogens, I mean the bacteria and the parasite ova which are present in the stool. Now, the other diagnostic process or procedure which is called as lower abdominal endoscopy or which is called as colonoscopy. So this is a flexible tube fitted with video camera is passed through the anus in the various parts of the intestine, especially the large intestine, from rectum onward to the ascending colon, transverse colon, and the descending and sigmoid colon. So the interior of the big gut or the colon is observed by this electronic device. But this is to detect the other pathologies producing the inflammatory disease of the gut. I mean colorectal carcinoma, anal fissure, various lacerations, Crohn's disease, celiac disease, and the hemorrhoids, especially the internal hemorrhoids. But there is no pathology in irritable bowel syndrome in the lining or in the walls of the guts or gastrointestinal tract. It is absolutely abnormality in the motility of the gastrointestinal tract. Bowel movements they are abnormal, which produces abnormality in defecation and in the formation, color, and the consistency of the stool. So these various processes are performed only to exclude the other inflammatory abdominal or the bowel diseases.